If you've been massaging your jaw, stretching your neck, maybe even wearing a night guard, and your pain keeps coming back, there's a good chance you're missing the most important part of the picture. Because jaw pain, headaches, tooth pain, ear symptoms, facial tension, they're often not coming from the joint itself. They're coming from specific muscles doing very specific things that almost no one explains properly. Today, I'm going to show you how to safely and gently self-massage 4 key jaw muscles: the temporalis, the masseter, the medial pterygoid, and the lateral pterygoid. And just as importantly, why they get overworked, what symptoms they create, and how to move your jaw in a way that actually helps instead of irritating it. And if you've ever had jaw pain, headaches, clenching, clicking, tooth pain with no dental cause, this video is one you'll want to save. Before we start, a couple of important things. This is not aggressive massage. This is not digging in, forcing release, or pushing through pain. Research consistently shows that gentle pressure, slow movement, and nervous system safety are far more effective for chronic jaw tension than force. Pain does not equal progress, especially in the jaw. And if anything you try today increases your symptoms, that's information, not failure. Stop, back off, and reassess. Jaw muscles are deeply connected to stress, breathing, neck posture, sleep, and your nervous system. So we're working with the system, not against it. If you've ever thought, I've tried massaging my jaw and it didn't help, you probably worked the wrong muscles or work the right ones too aggressively. Let's start with the one almost everyone ignores. The temporalis is a large fan-shaped muscle on the side of your head. Its job? Elevate the jaw, closing. Assist with retrusion, pulling the jaw back. It's heavily involved in clenching, grinding, sustained jaw tension, stress-related jaw holding. Trigger points in this muscle can really get your attention, often sending pain signals that result in familiar symptoms. They fall into 2 categories: active trigger points, where you feel the pain right now, and latent ones, which only hurt in specific areas when pressed. Many people notice this discomfort in spots like the temples, behind the eyes, upper teeth, and sides of the head. This is one reason people experience tooth pain with normal x-rays. Place your fingertips gently above your ear and into the soft tissue of the temple. You're not pressing hard. Use small circles or slow melting pressure. Let the tissue soften under your fingertips. Work upward and forward, not just one spot. Spend 2 to 5 minutes covering the whole area. If you find a particularly painful spot that sends pain elsewhere, that's a trigger point. Hold it for 10 to 12 seconds before moving on. Remember, we want tolerable pressure, no gold stars for suffering. Now add slow jaw opening, but only as far as feels easy. Inhale as you open. Exhale as you close. This helps coordinate muscle relaxation with breath, which research shows improves outcome for TMD care. If you've had headaches for years and no one has ever talked to you about this muscle, that's not unusual. But we're just getting started. The masseter is your primary chewing muscle. It's powerful, thick, and extremely reactive to stress. Chronic clenching can cause it to hypertrophy, bulk up, shorten, develop trigger points. Masseter trigger points can cause jaw pain, ear fullness, ear ringing, tooth sensitivity, facial asymmetry, and limited mouth opening. Place your fingers on the cheek just in front of the jaw hinge area. Clench lightly, then relax. You should feel the masseter activate and then soften when you relax. Apply gentle pressure and slow circles. Avoid sliding on the skin. Sink into the muscle. Lift your fingers and move down from the cheekbone area by about a finger width. Then repeat the circles. If you find a trigger point or extra tender spot, then hold for 10 to 12 seconds. The tenderness will start to decrease over this period. If it isn't, you're most likely pressing too hard. Follow the muscle all the way to the bottom of the jaw. With clean hands, place a finger inside the cheek. Pinch the muscle gently between the internal and external fingers. You can lightly clench your teeth to feel the muscle get bigger under your fingers to ensure that you're on the target area, but keep the muscles relaxed while you massage it. This should feel tender, but not sharp. If it feels threatening, skip it. Safety always comes first. If you are okay doing this, then cover the whole muscle from the top to the bottom, stopping whenever you feel the need. Add small side-to-side jaw movements within a pain-free range. This improves muscle coordination, not just length. With your teeth apart just enough that you can slide your jaw to the side without them touching. Slide your jaw to the right slowly, only until you feel a slight tension in the muscles. Then stop here. We're not going for distance. It might not be far. Slide your jaw back to midline and pause. Slide your jaw to the left again, only as far as you can before you feel tension in the muscles. Pause and come back to midline. Repeat the process going back and forth, concentrating on moving slowly, easily, and comfortably. Now we're going to talk about two muscles that almost no one explains, but they often drive clicking, deviation, and joint irritation. The medial pterygoid lives on the inside of the jaw, mirroring the masseter. It helps with jaw closing, side-to-side motion, and grinding our food. Stability during chewing. When irritated, it can contribute to deep jaw pain, throat or ear discomfort, difficulty chewing, a feeling of tightness inside the jaw. This muscle is best approached indirectly for your first attempt. I'll add a link for the internal technique at the end. Instead of digging inside the mouth, massage under the jawline near the angle of the jaw. Hook your fingertips or thumb up under the bone and press outwards. Use slow pressure. Work with breath. Try small, controlled jaw opening with the tongue resting softly on the roof of the mouth. It's suctioned up there. Open only as far as you can, easily and comfortably, even if it's tiny. It's not a challenge or a test to see how far you can move. Do 10 of them. This reduces overactivation while maintaining our coordination. If your jaw clicks, shifts, or feels unstable, this next muscle matters more than you've been told. The lateral pterygoid is a deep stabilizer of the temporomandibular joint. It controls jaw opening, protrusion, disc coordination inside the joint. It's often blamed, but rarely understood. Irritation here can contribute to clicking or popping, jaw deviation, locking, pain deep in the joint, ear fullness, pain, and ringing. This muscle should not be aggressively massaged. Research and clinical experience show that overtreating it often worsens symptoms. I teach manual therapists, including massage therapists, physiotherapists, and chiropractors, 4 different techniques for treating the lateral pterygoid muscle in my Simply TMJ webinars. You can find the link in the description. Here's one of the methods that I demonstrate. We apply gentle pressure on the masseter muscle, aiming to reach the lateral pterygoid through a small opening. To create this opening, we slightly open the jaw, but not so wide that it stretches the masseter muscle and makes it tense. If the masseter becomes taut, it will be more difficult to press through it effectively. I like to think of this opening in our jaw as a window. It's shaped by 3 key parts of the skull: the zygomatic arch at the top, the condylar process at the back, and the coronoid process at the front. Depending on your individual anatomy, this opening can be small or quite large. To get a sense of these bony areas, place your fingertip about 3 finger widths in front of your ear and try to feel for these landmarks. Press in and hold for 10 to 15 seconds and then let go. If it hurts afterwards, you're probably pressing too much. Here's a safer approach if you're uncertain of your landmarking. Instead of direct pressure, focus on gentle jaw opening. Use slow, controlled movements and coordinate it with breathing. Try this. Open the jaw halfway and pause, keeping your jaw relaxed. Place your index finger on your chin. Gently press your chin backwards and downwards with your finger. Now let your jaw relax further open as you apply the gentle pressure. No forcing. It will feel like a subtle stretch. Quality over range. Hold for 30 seconds. You don't need to do everything every day. Pick 1 or 2 muscles that resonate with your symptoms. Work gently, work consistently, and remember, jaw pain is rarely just about the jaw. It's about how you breathe, how you manage stress, how your nervous system feels, how your neck and posture support the system. And if you want to learn how to treat the medial pterygoid from the inside the mouth, here's the video. If this video helped you understand your jaw in a new way, let me know in the comments. Start gently, be curious, and remember, your jaw isn't broken, it's responding.